Welcome back to SA Live. There it is. We asked you to show us your Fiesta medals. Send in those photos, and we'd love to see them. Antoinette says, 83 and still collecting. Way to go. Viva Fiesta. Well, an accident can happen anywhere, especially during all the Fiesta fun. So Dr. Sebrina Perkins with GSEP Emergency Medicine Physicians is here with a few Fiesta safety tips. Welcome, welcome. First of all, let's show. We've been asking people to show off their medals. Let's show off this medal. Tell folks what it is.
Well, basically, this is a medal representing our Methodist hospital system. And I'm specifically here with Methodist Children's, but I think it's lovely. It's got some nice colors to it. So,
oh, yeah, very pretty. And one of the big things this year is that you guys have an app that folks can use, right?
Yeah, we do. We actually have an app that will allow people to access any Methodist ER in our city. And with regards to, for instance, Methodist Children's, you can just log on to this, I think it's MHSER or app, I guess, and basically look up which hospital is closest to you, and it'll even give you a wait time.
And there it is, MHSER.com, and you can download the Methodist ER app, and that is, of course, on Apple and on Android. And so you can basically find any Methodist ER on that?
You sure can.
Okay, so does it have like the one where it finds me? Like, here I am, help me.
I wish it could. It'll give you the locations and find the one that's closest to you, and then you can access the wait times. That way you have an idea of how long you'll be waiting before you get seen.
So folks need to remember a few things, of course, going into Fiesta for not only their own safety, but safety of their children as well. What's the first thing that they need to know?
I think right off the bat, anything that's heat-related, you want to try to prevent any kind of issues and concerns that can affect your children and the kids. So prevention's a big tip. I would say probably want to make sure that your children have plenty of water bottles, cool drinks, coverage like using umbrellas and caps and hats for them would be great to prevent so much exposure to the heat. And you can also kind of just consider a little of the clothing they're going to wear, lighter clothing, lighter colored, and even closed-toed shoes would be a great idea just so they don't get stepped on or struck or step on glass, ththings of that sort.
So you may want to leave those flip-flops and open-toed shoes kind of at home just, of course, to prevent that. So you're out there, of course, you're with your family, you're in the heat. As a parent, dehydration, of course, is a concern, but your child can't really tell you, oh, I'm getting dehydrated. What symptoms should a parent be looking for?
Sure. So for younger children and for infants, I mean, you certainly want to think about the fact that their behavior could change. So you might think that children are perhaps crying more. A later symptom might be that they're more lethargic, more quiet. I certainly would worry about a child whose eyes look a little more sunken, who maybe aren't producing tears when they're crying. And I think fewer wet diapers would be a concern that perhaps they could be getting dehydrated. A lot of it is proactive behavior. You know, offer your children something to drink every hour to 2 hours. That way you know they're getting that drink. Infants can't tell you when they're thirsty, so you need to just think ahead, think for them.
All right, and so there are common injuries during Fiesta, and you have some examples.
Absolutely. So common ones are children are going to want to be active. They're going to be out and about for hours, and so bleachers and scenarios where children can actually climb would be where they can potentially fall. And this is actually an x-ray of a patient who had a fall. No surprise, it happens, but you'll see that the distal end of the those bones, the radius and the ulna, do show some concerns for fractures, and it's all about prevention. We need
be careful when you're getting down off those bleachers, perhaps, or stepping off the curb.
And watch your children. You know, it takes the community to take care of them. Yes.
All right, keep an eye on them, keep them close. Once again, thank you so much, Dr. Sebrina Perkins with GSEP. For more information on GSEP, you can call 210-575-4444. Again, that's 575-4444, or visit GSEP.PEM.com. All right. Coming up.